Hi everyone, so today we're going to be talking about a really common problem, which is increased hair shedding, or what we call telogen effluvium. But we can't really talk about that without understanding the normal hair follicle cycle. So the normal hair follicle cycle actually has 3 stages to it. The first stage is called anagen, and that's when the hair follicle is actively growing. And that is genetically predetermined in terms of its length, so it can range from 2 years up to 7 years, which is why some people can grow their hair all the way down to the floor, and other people like me can only grow to their shoulders. After anagen, the hair follicle will then move into a very brief transitional phase, which is called catagen, and this only lasts for about 3 weeks, but essentially the hair follicle stops growing during this period of time. And the final stage is called telogen, which is the resting phase, and this generally lasts about 3 months. At the end of telogen phase, the old hair will be pushed out because a new growing hair is coming through. So in the normal scalp, 90% of the hair follicles are in the active growing phase, anagen, and the remaining 10% are cycling through the other phases. So what happens in telogen effluvium is that ratio changes from 90% anagen, 10% telogen to perhaps 70% anagen and 30% telogen. So essentially what's happened is that the hairs in anagen have prematurely moved out of the growing phase and into the resting and shedding phase. And what patients will often see is more hair coming out in the shower when they're combing, and with that, a gradual reduction in the volume of hair. There is a long list of potential triggers that can cause telogen effluvium, and usually it appears about 3 months after the onset of this trigger. So common triggers will include nutritional deficiencies, dramatic weight loss, being really quite unwell, particularly with a fever type illness, certain medications, and also hormonal fluctuations as well. Assuming that the trigger factor has been corrected, there will then be a gradual slowing down of the shedding that has been increased in telogen effluvium, usually within about 3 to 6 months. But in terms of regaining the actual volume of hair, it's going to take much, much longer.